heart syndrome has been recognized since the 50s, actually first seen in relation to subarachnoid hemorrhages. And it consists of many different aspects, and it's just kind of a clinical definition that we can call it the stroke heart syndrome. It can relate both to strategic strokes, that means a specific location, the lesion in a specific location in the brain leads to a higher risk of cardiac events, and that is especially the area around the left insula and possibly also around the right lateral side of the medulla. But also severe strokes, and that's very much depending on the severity, will almost always be followed by some cardiac symptoms. The most common are arrhythmias, and that can just be excess sweat activity. It can, and things like that are really not that important, but it might also be very severe things like interruptions of above 5 seconds, which is obviously very severe. And there is a higher risk also of cardiac arrest based on arrhythmia in relation to subacute stroke, and it's related to strategic strokes. I think it's important that we have our neurocardiac conferences. In my institution, we have weekly conferences where we discuss complicated patients, principles of what we're doing, and I think that's absolutely necessary, because otherwise, if we have a patient with a PFO, then the cardiologist has one opinion, the neurologist has another one, and the patient is in between. So as we have a lot of issues to collaborate on, I think it's very important that we have a close and trustful collaboration, and that means that I think that all hospitals with stroke function and cardiac function at some level should have at least weekly conferences, because otherwise they will just fight each other, and then everything will end up in discussing how many echoes are necessary.